Morning.
I pledge allegiance to the flag of the United States of America, to the republic which is standing one nation under God, indivisible, with liberty and justice for all.
Ladies and gentlemen, instead of our invocation this morning, I'm going to ask for a moment of silence. Thank you. Melanie, if we can have our roll call, please.
Commissioner Turnbull,
Present.
Commissioner Aaron's,
Here.
Commissioner Hankins,
Here.
Commissioner Mason,
Here.
Commissioner Mapes,
Here.
Commissioner Levanway, here, Commissioner Rubing,
Present.
Commissioner Chamberlain.
Here.
Right. Next up, folks, we have public comment. I'm setting up my timer right now. If there is public comment, we would ask you to come to the podium, state your name and the county of residence. You'll have 3 minutes to address the board. I will let you know at about 30 seconds. And you have 30 seconds left. Chris, do you have a sign up for me? Thank you. Thank you, sir. First up, we have John Swartout. Morning, John.
Good morning. John Swart out of Emmett County. Budget meeting, lots of acronyms and initializations in the budget. It's hard for a layman to follow along, but I had questions. I know this is not Q&A, but maybe you'll have similar questions. How much of the school nurse program is funded with COVID money from the state that is scheduled to end 7/31/24? And then what? What do school nurses do when school is out? $1 million for 10 months of sewer screening for COVID? Is that a good use of public funds? 6.25% of the budget is COVID spending. I guess we're not putting COVID behind us just yet, are we? $134,562 for COVID vaccinations. Have we learned nothing? Look at the Schmeling study in Denmark. 4.2% of COVID vax recipients have life-threatening and life-altering side effects: myocarditis, pericarditis, stroke, blood clots, sudden death, menstrual disruptions, miscarriage, autoimmune disorders, just to name a few. The Public Health Code in Michigan says, in part, a local health department shall make investigations and inquiries as to the causes of disease and especially of epidemics, the causes of morbidity and mortality, the cause, prevention, and control of environmental health hazards, nuisances, and sources of illness. I didn't see anything in the budget. Maybe it's hidden in an acronym somewhere, showing that the Health Department of Northwest Michigan is following up on the people that they vaccinate to determine what the side effects might be. Oh, well, that's not for us to do. That's for the CDC. Well, the CDC is not doing it. So how do you deal with the Michigan Public Health Code that says you shall make investigations into public health issues such as COVID vaccine side effects? Oh, but I want my kids to be protected.
30 seconds left.
Don't you have an obligation to educate people? When somebody comes and wants to have their child vaccinated against COVID-19, don't you have any obligation to tell them what the risks are and what the minimal benefits are? Thank you.
Greg Bentley.
Good morning. My name is Greg Bentley from Charlevoix County, taxpayer.
And I concur with the last gentleman that spoke. I think the key issue is informed consent. I see that there's items on the next budget for a COVID vaccination. Now, that COVID-19 vaccine was never officially approved by the FDA. It was just had emergency use authorization. Now, when I had talked to a lot of my friends and family who have gotten myocarditis, who have gotten cerebral palsy, who've had a cerebral ischemia, they were not given informed consent on that vaccine. I think it's this board's responsibility to oversee these folks that are propagating an experimental vaccine on the citizens of these 4 counties. I would hope that you would do your duty, that you're sworn oath to defend their constitutional rights.
Suzanne Skubik.
My name is Suzanne Skubik, Charlevoix County, and I just want to say that I support vaccines. I support the use of masks. And I just wanted to quickly read a short letter to the editor that was in the Charlevoix County Press, if that would be all right. To the editor, the Health Department of Northwest Michigan has done an outstanding job the past few years in getting us safely through the COVID-19 pandemic and continues to use the best science to keep us safe and healthy, but they can't do it all themselves. Given the fact school children are facing all sorts of challenges as a result of the pandemic, it is more important than ever to seek and accept assistance in addressing these issues. There recently have been grants available from private nonprofits that would have helped our health department work with children in the areas such as nutrition, dental health, and vaping education. They were not accepted by the Board of Health. The Board of Health and the County Commission need to step up and accept these grants and when they become available. If a commissioner refuses to accept or even consider these grants, that commissioner should resign from that committee or be removed by the commission. Our children's health demands it, and the health department needs our support. Under section 333.2226, powers of the department, section E, it says, accept gifts, grants, bequests, and other donations in the name of the state. And in another area of the health code, 333.2435, local health department additional powers, section E, accept gifts, grants, bequests, and other donations for use in performing the local health department's functions. So just wanted to point that out, and thank you for your time.
Thank you. Mark Rebecki.
Mark Rebecki from Emmett County. It's pretty distressing to hear just what I heard, which was you must automatically accept, otherwise you don't support. And I think that's crazy. The other thing is this budget, $34 million. I can't even comprehend that. I can't believe that you're spending that much money. It's unbelievable. And then you tell me that you're only going to increase the budget by $330,000, which is immaterial. Well, you know what? Not to me. I hate to tell you this, but $330,000 would take care of me for 10 years at my current rate of pay. So, you know, it may be immaterial to you, but it's not immaterial to me. And here's the other thing too, is that you as the health department are providing all these services to people. And when you're doing that, you're increasing demand. You're putting more people on more stuff and increasing demand, meaning you have to grow, and which leads to higher prices. So what you end up doing, you end up chasing your tail, and you end up making things cost a whole lot more. than they really need to be costing. And then you have to have programs from the health department to help people pay for these things because you've created this artificial demand and you don't have the supply. And you're actually making the supply worse because you're increasing demand, which we all know brings up the price. So, save us some money, do some responsible stuff and stop spending all this money because this bureaucracy is, in my opinion, out of control. It's huge. And that's the whole idea of bureaucracy, is to grow and to get so big that you can't do anything about it. And I'm afraid that we're approaching this point, and I hate to see that happen. We've got to get this thing under control, people. And especially with this COVID spending, we put in all this extra money for COVID spending, and we can't seem to get rid of it. It's about time to get rid of it. COVID's done. It's over. We're finished. Everybody's got the number. They know this whole thing was a disaster, and they know this COVID stuff was just a way to gain control over the people. All these studies are
30
showing that masks actually do no good and maybe even cause harm, because if you cough or spit, you end up swallowing it, or it gets infected because it's out there and you end up breathing it and making things worse. So all the studies and things are showing that these things don't work. And now we have the latest round of this vaccine, which has not been tested at all. It's just been released, and you're supposed to have faith that this thing is going to work.
That's your 3 minutes, sir.
Thank you.
Bob Wiley.
I'm Bob Wiley. I'm from Emmett County. I've lived in the Petoskey area for the last 15 years, but owned a cottage here in the Petoskey area for about 30 years. In Ohio, I was a physician practicing in ophthalmology, but prior to that, I was an emergency room physician. So I have some medical background and have written papers on the origin of COVID. I was vaccinated, and I'm fortunately a survivor of one of the cardiac sudden death events that can occur after vaccination. Do I say it was a vaccination that caused my sudden cardiac death? I don't know. I have some physicians that say absolutely, other physicians that say that probably not, or just refuse to comment on the cause. But I'm here today, and I have faith in the members of this board and the members of the Emmett County Board to make good decisions. I think it's a good group of people, and the people that have shown up here today. I think there isn't a person here in this room that isn't have their heart in the right direction and trying to figure out do we need 34 million to operate? And I'm hoping that you can put some of the things that are failing maybe on the page, and then decide, is this money helping or making it worse? What are some of the things that are sort of beneath the problems of our communities? But what's the health of the family these days? What's the percentage of fatherless homes? What's the percentage of dysfunctional neighborhoods? Will your grants and will your programs help strengthen the families? If not, can reconsider. Will it help increase personal responsibility over a long period of time? If not, reconsider. And be aware that when there's free money available, at some point that free money is likely to stop, and you will go back to being personally responsible and going back to being a group of commissioners that will have to take care of the people without outside money.
Audrey McMullen.
Good morning.
Maureen.
The first thing I want to say to all of you is thank you for your service. You don't have an easy job, I get that. But I also get that we are all gathered here to be of service to our communities, to help our communities thrive in every way. We don't want to see hungry people. We don't want to see sick people. We want to see healthy people. And it's everybody's job to do that. We are all accountable for what we have in our communities and for the care that we give each other. These are the bottom lines of your service and of our interest. And again, I thank you for your service.
Would anyone else like to address the Board of Health?
I hadn't originally come speak today. Joe Murphy, Emmett County. The health department's been around for 90+ years. And the purpose of the health department is obviously to help those who in need be healthy. The COVID money, which you have, was planned out for a certain period of time with a scientific understanding of how long COVID is and how coronavirus changes. For those who don't know, coronavirus is the same as a common cold. If you get it bad enough, you get pneumonia, you die. Coronavirus is the newest common cold type virus. And some people want to stop the funding. They don't want to continue it in schools. To me, that's insane. Are we going to ask those who got PPP money 3 years ago to give it back? Because some got a lot of money. Well, it was for a period of time. So maybe they should give their money back too, if that's what people are going to do. So we basically, the reason we have the COVID money for this period of time was to, with the knowledge from the scientific knowledge, knowing how often the thing mutates, how much money we probably would need. And it's basically been true. We're getting another spike. A couple of the counties in northern Michigan are above the rest of the rest of the county, rest of the state. We don't know if that's going to happen in these 4 counties. Kalkaska County is one of them. They're just south of Antrim. So we are getting a spike in northern Michigan in certain areas. Luckily, the health department and work of the doctors have kept us safe here. Our spike isn't as high, but it has gone up. With kids going back to school, it'll probably go up more. So please keep that money through the 24, because there was a reason for it to be put in there through 24, and we're seeing it. Thank you.
Would anyone else like to address the Board of Health? Yes, please.
My name is Louanne McKimmey, and I'm from Elk Rapids, Milton Township. I have been vaccinated. I've had my boosters. I had a couple of nights that I didn't sleep well, but that was it. I can't say that for everybody because I am one person. I spoke about this before. There's a lot of fear. There's fear of each other. There's fear of education. There's fear of science. And we all have to do what we believe is best for ourselves. But science has shown that septic tanks contain a lot of information about what's going on in our bodies. And the septic tanks in the United States right now are showing a lot of COVID. Hasn't happened yet. There has been a spike. I'm going to get another booster shot. My husband will too, because he's a cancer survivor. So I think we all need to listen to each other, but there's fear. I'm afraid of some of you and your decisions, because I have seen what it can do. In our public health department is a place where people come for help. I am fortunate I have private insurance, but not everyone does. Not everyone has any dental insurance. Not everyone has food to put on the table. Not everyone has nutrition education about how you can keep your body healthy. But this is something that this county, these 4 counties need. We've looked at the poverty situations. We know that we have a lot of people here who don't have the ability to go to a doctor to get insurance. So I ask you to think carefully about it. Let's not be afraid of each other. Let's discuss the issues. Let's talk about them. Let's make sound decisions for the people that we don't know. Thank you.
Would anyone else like to address the Board of Health? Hearing none, we will close public comment now. Moving on to the review and approval or review/approval of the proposed fiscal year 2024 budget. Ms. Klanowski.
Check, check. Okay. Thank you, Chairman. If you all will allow me, we do have a new board member today, and I wanted to welcome Commissioner Aaron's. I do want to kind of recap what I've recapped in the previous meeting, just so that he has the same information that you all have. So it might be a bit of a repeat, but if you will just bear with me, I would appreciate it. My name is Shannon Klanowski. I'm the Chief Financial and Administrative Officer for the department. Mr. Aaron's, I know we have not officially met, so it's nice to meet you.
Nice to meet you too.
A bit of my background. I was born and raised in Charlevoix, worked for Ernst & Young when I got out of college, moved to Nashville, Tennessee, spent the last 15 years there. Absolutely loved it, but family was here and this was home. So I was the Chief Financial Officer for the Tennessee Department of Agriculture when I left. Found this position. I think it was one of those meant to be kind of situations. And here I am doing the same thing, just at home. So it's good to be home.
Welcome back.
Thank you. It's been a year. I accepted this role August 28th last year I started. So I've been on the staff for a year. I have a phenomenal staff behind me. Andrea Pierce to my right. She is my right-hand person, literally. Just coincidence. She's sitting to my right today. She has been with the department for a number of years, has all the historical knowledge and information. So if I cannot answer your question today, I guarantee between the two of us, we can answer your questions. We have a great accounting team behind us and our leadership staff. Dan, I appreciate your leadership so much. And trust me, I interviewed you just as hard as you interviewed me. So it's good to be here.
Good to know.
I didn't tell you that till today, did I? So I want to walk through this budget at a high level, and I'll try to go quickly because I know most of you have already heard this. Let's see. I always like to tell people budgeting is an art. It's not a science. I wish I had a crystal ball that could tell me exactly how much money I would need for next year, but I don't have that. So we use historical data. We use the pieces and parts that we know, and that's how we put it together. I do want you all to be aware that a number of these pieces and parts have not been finalized yet. The state has not finalized a lot of the numbers and grants that they're giving us and the funding sources that they're giving us. So what they do is they say, well, take last year's number, and if we increase it, we'll let you know later, or if we're going to decrease it, or however they're going to change it. So a lot of this is based on what we know to date. It's not perfect, and that's why we come back to you for a revised budget later, because as we learn those pieces and parts, we will come back with a revision. So keep that in mind. We are a regional government, as I like to say. We are not a county government. We don't serve just one single county. We serve 4, which means we've got a lot of work and we got a lot of area that we cover. As you would expect, typically our budget is higher than single county budgets because we are serving those 4 counties. We are also significantly grant funded compared to counties. We like to be innovative. We like to be leaders in how we operate. And one of the things that we are very proud of ourselves about doing is matching funding and finding funding sources that are a little untraditional in the sense of some of our sister agencies across the state. We do not fully rely on state funding or local appropriations. We find other ways to make some of these programs happen. So you will see that throughout our funding. We also ask for minimal local appropriations compared to our sister agencies. You'll notice that our total local appropriations makes up 6% of our budget. So we keep it low. We're also keeping it flat. We are not increasing that this year. I will not be coming back to you asking for more at this point. So we're very proud of that too. let me see, this is a balanced budget. There's a little bit of surplus that is related to our dental portion, but by and large, it is a balanced budget that I'm bringing forward today. It's also essentially a flat budget. It's a 1% budget increase. And if you talk to your counties, that's a really tough thing to do these days. The rate of inflation, all the extra costs that you're seeing across the board, we're trying our best to hold this as flat as possible in a very difficult economic situation and not knowing what's coming. So let me see. I do want to, there's a point of clarification I would like to make in the memo in the packet that you received. I do want to clear up one of the paragraphs related to the environmental health fees. There's an increase of 2 to 3% across the board in our environmental health fees to help offset the increases in mileage, supplies, salaries, inflation in general. And then separately from that, if the counties do not fund their portion of the local appropriations in full, then we look at assessing a surcharge. Thank you. See, got it. A surcharge if needed. So I wanted to make that point of clarification because my memo was not as clear as it could have been. Let me see. So if we take a look at this budget, and I'm going to go over at a very, very high level, we're going to dive into questions because I know you have them and I'm going to be happy to answer them. But at a high level, if you look at our expenses, I'm going to start on the expense side. Salaries and wages are our largest expense, and that's not a surprise at all. We provide services, we help people. So it's not a surprise that our largest expense is the people that are doing this work and providing those services. If you look at salary and fringe, it's about 47% of our total expenditures. I have gone through this with a fine-tooth comb this year. It was a heavy lift. It was not an easy project, but I have confidence in these numbers and this budget being presented. I feel like this is as accurate as we can possibly make it at this point. Some people may come, some people may go, but from what I know today, this is as accurate as we can get it. You will notice that compared to last year, it increased 2%. Now we do have a Board of Health approved 3% increase, but when it was all said and done, and we had, some positions that we have not backfilled because we're very conscious about making sure that we're only filling the needs that we have, the increase was only 2% overall. If you take a look at the contractual and consulting line items, it's increased $352,272. This is mostly due to our dental clinic staff salaries and fringe benefits increasing, and also vacancies that have been filled on the dental side and more services being provided. So that increases it's all due to the dental side of our business. Travel costs. This is one that I really want to point out and take a moment here. Our staff have worked really, really hard to cut budgets as much as possible and to make sure that we are being fiscally responsible. We had a total decrease on average of 33% across the divisions. And this is, like I've said before, one of those few line items where we actually have control and we can actually, do our best to help keep those costs down. So we've worked really hard on that one. And the other expense category, this is one that I'm just not a fan of, and I know you aren't either. Other expenses can get kind of murky, kind of fuzzy, and I don't like that. So we've broken them out, and we are going to continue to break them out. So if you look from health services, we've broken down from this category. We've got health services, computer software, other contractual, advertising, media. Those were all rolled up into that other expenses line item at one point in time. We've broken them out so that you can see a little better what's going on in that other expense line item. So there's some increases and decreases within those line items, and they all kind of net each other at the end because by and large, it's all about breaking those out, cleaning them up. It will continue to be broken out going forward. Equipment line item, it has increased. This is mostly due to our dental labs and our environmental health lab. We ask them every year to give us a list of their equipment needs, what needs to be replaced, what's coming to end of life. If we have to cut things back as the year goes on and we're not collecting revenues as much as we expect to, then this is usually our first place to go in and say, whoa, hold on, we can't replace that this year. We can't afford it. Let's look at it in a future year. So that's the line item for equipment. Revenues really quick. Fees and collections have increased. This is due to the new dental reimbursement structure and also the increases in our community health school services. State funding line item has decreased, and this is because of that dental reimbursement structure that changed January 1st. We no longer collect state plan amendment or SPA dollars. So that you'll see the decrease there, but you'll also see an increase in our fees and collections because they've gone to a higher rate of reimbursement that now matches the private reimbursement rates. Grant funding has decreased. It's a net result of programs ending, programs with reduced funding, and reclassification. So it's all kind of a hodgepodge in there, but and when it's all said and done, it has decreased $1.4 million, almost 1.5. Local grants, that also varies with the reclassification that we had. You'll see up in the grant funding line item, there's reclassification. It's also in the local grants. Hopefully going forward that we will not have to reclass those. Again, we were cleaning up accounts this year when I came on board, asking people to, give me a better understanding of these. So hopefully they will continue in those categories moving forward and you won't see a change. I think that's kind of the high level of the budget. One other thing I wanted to touch on, Commissioner Rubin had asked for a list of COVID funding that we are receiving in fiscal year 24. And I know it's already been talked about in public comment and it's out there. It was part of the packet. I do want to give us a chance to talk through these. I do want to let you know that, it's $2 million. And although our budget has increased, we're holding it flat as much as possible. And a lot of that increase is due to the dental side. You have to remember during COVID, people were not getting dental services at all. And now we're coming back. We've got more services that we're offering than ever before. We are now almost fully staffed. So that's driving it. And the other piece to that is the mental health services in schools. We had a very small program before COVID. And during COVID, we were asked to ramp that up by the schools. And so that is also driving a lot of that increase that you're seeing in our budget from year to year. But Dan, if you don't mind, would you go through the COVID funding and explain that in a little more detail?
Sure. Is my mic? Yeah, I think
Yes,
it's on.
you're on.
Yeah, so basically just going down the list, there were 4 grants that were listed there. Number 1, workforce development. Really what that has to do with is staff training, recruitment, retention, to help maintain the public health workforce and to be able to have the capacity to respond to infectious disease incidents or environmental health hazards or whatever it may be. This is really crucial funding at this point because across public health throughout the state and the country, actually, the workforce has decreased because of the strains from the pandemic and just from people retiring. The workforce is aging, and it is really important to continue to do that work. We are an integral part of any incident management response in the state. We're part of the National Incident Management System. We do all the training with law enforcement. We work with emergency managers in each of the counties. And it could be, something that was in the news just recently in Sheboygan County with the tissue plant fire. That's something that public health would be involved with from the environmental side, like more or less the aftermath of, because right now the worry is that there's some contamination going into the river there. So, and then also any health concerns related to the fire with air quality. So that's a perfect example of the type of work that we do in that particular arena. Yes, it was started with COVID funding, but it does transfer to other areas of our work. So the other one is the sewer network funding, which currently is 980,000, which has 274,000 that was rolled over from a previous year. So I think at the end of the day, when we get through this budget, we may not be spending it all, but regardless, that work where we look at, we have 19 sites throughout the district. Some are long-term care, some are wastewater treatment plants. and some are schools where we do weekly wastewater sampling, and then we test that wastewater to look for COVID spikes. And we're actually seeing that now, and we actually notified a couple of schools about some spikes that we're seeing, and it gives them a heads up because there's about a 1 week lag time on that, about, you know, what to expect possibly. In the past, we have used that data to support testing in long-term care facilities. So we've been able to prevent outbreaks. And this is a national program that started with COVID. It's is really something that's been brand new, and we've made a lot of strides over the past, 3 years doing this. And hopefully this technology can be used and transferred to other communicable diseases to also lend that heads up. The equipment and staffing in this particular program is really expensive. This is through our lab. It's a molecular biology lab, and I would encourage any of you that would like to see our lab to take a tour because it's pretty impressive. Our school nursing program, this is a really important program. It's through HRA funding, which stands for Health Resource Advocates. And the other part of that is for sustained in-person learning. We basically have 9 HRA positions at the Health Department of Northwest. This is spread between full-time staff and supervisors. And we have a presence in 10 schools, 3 in Antrim, 3 in Charlevoix, 3 in Emmett County, and then 2 in Otsego County. And basically what that funding does is offer frontline support for COVID testing and reporting, but it also helps schools identify emerging infectious disease, no matter what it is. Those staff are not there just, sitting there waiting for a COVID case or whatever. They're working with school staff. There's many reportable communicable diseases that schools have to deal with, and basically taking that out of the hands of the school secretary where it has been in the past prior to the COVID pandemic, and really having some professional public health nursing staff in there to deal with these things that happen every day in schools. So it's really strengthening best practices in public health through consultation, prevention, and employing public health strategies. And it's something that we found really useful and important. The schools that are participating in this have also found a lot of usefulness with this program. We are not in any school that didn't want us. Initially, when this funding became available, we put it out there to the schools, and every one of them that wanted to be part of this partnership, those are the ones that we're working with. And so, this service is really important to support the children in their learning environment, I believe, and really advance our public health mission to prevent disease and support good health amongst the community. So lastly, COVID immunizations. This more or less is rolling into our regular immunizations program. I mean, this is one of the 8 mandated services called out specifically in the public health code beyond our broader mandate. And is what we use to support COVID vaccinations through our health department, which is an important piece of our total immunization strategy. And many people in the community are seeking and wanting updated COVID vaccinations, and we are there to provide that. We assess and inform people about the risks and the benefits, and it's up to them. It's their decision whether or not they want to get immunized or not. And if they don't, they don't. That's fine. We will never, we don't mandate, we would never will mandate COVID vaccinations. Just a point of clarification. We don't mandate any vaccinations. It's a choice. We simply are there to provide the service, and we give them the education that they need to make an informed decision based on their own health and what their doctor recommends. So that's basically the rundown of those line items. All, I think, are very important pieces of our overall public health budget, and really, pushes our is in context of the broad mandate and our very specific mandates on preventing disease, managing disease, and prolonging life in the community.
Thank you, Dan. Thank you, Shannon. Any members of the board have questions? Mr. Rubin?
Yeah, Mr. Chairman, we just heard about this COVID money and how it's so important for staff. And it's so important to check sewers. And it's so important to keep school nurse program going. And it's so important to keep COVID shots going. Mr. Chairman, when you and I started on this board 3 years ago, the budget of the health department was $29 million. We're over 34 million. We want the money. We need the money, and it's never, ever enough. And we can always find ways to spend it that are so useful and so needed. But at some point, we have to realize that it's not the government's job. And we keep on hearing again and again and again, whether it's Democrats or Republicans or independents, that COVID is over, but we can't give up the money for it. I've had it. I'm ready to give it all back. So I guess at this point, I would like to make the motion to eliminate this $2.15 million and put zeros in workforce development for 2024, in the sewer network for 2024, in the school nurse program for 2024, and in the immunization line item for 2024.
There's been a motion. Is there a second?
I'll second that.
Seconded by Mr. Mason. Any further discussion?
Mr. Chair.
Mr.
yeah, I
May,
have-
go ahead.
I have some, yeah. You're right, Shannon, you didn't answer most of my questions.
Don, would you make sure that your
Before I
microphone
had a
is on,
chance
please?
to ask them. Does it
Yeah,
sound-
okay,
is
I
it
think
on?
you're on.
Okay. You did answer most of my questions before I had a chance to ask them. I'm just curious. I'm looking at for fees and collections, that fees and collections are obviously the health department doesn't serve this. I want to formulate my question.
Don, I don't mean to interrupt you. I think that's a question regarding the general budget. Right now, we have Mr. Rubin's
we're on the
motion
motion still? Okay.
regarding specific COVID funding.
Well, I do have the same question myself, is why do we keep funding COVID if it's over? I keep hearing the comments from Democrats and Republicans that we need to put COVID behind us. Now, I'm sure probably most of this money is already in our possession. We're not having to apply for new funds. But that's just a statement that I wanted to make, and a question that I need to answer, because it's going to continue. It's got to stop somewhere. And I'm curious what that would do to the budget. I mean, that's a sizable chunk of money, $1.8 million. But at some point, we're going to stop receiving that money from the government. And it's going to affect employees. It's going to affect staff. It has to, that much money. So I'm just curious what's going to happen when that happens. And we keep hearing that, the COVID's over with. Maybe we need to look at a different way of handling it.
Can I answer that?
I'm not
Mr.
sure if
Chairman?
Dan wants to or Shannon, but
Let
Well,
Dan
I-
start. I'll jump in if I need to.
Yeah, I mean, to say COVID is over with isn't it? I mean, we're in a much, much better place than we were. It's still out there, and it's, now we're not in emergency response, we're in disease management. Okay, that's where we are with COVID. A lot of these funding line items are ending, and as far as what will happen with the staff that are supported by these, those are things that we need to work on and figure out. I know in the school nursing program, we have lots of schools, 10 schools that are partnered with us and are relying on our nurses to be there to help them through this. I still believe we're in a transition period. Yes, the public health emergency ended in May. It doesn't just stop everything right in its tracks. I mean, there is kind of this time period where we're transitioning into a different place, which is disease management. We'll have COVID around forever. Okay. I have no doubt. It's just going to be part of the lexicon of diseases that we deal with every day. Some of the schools, many of the schools have said that they want to continue funding those positions through their own sources of funding when this funding runs out at some point. I don't know. I have no idea what the state has in mind or what they are looking at as far as any different funding that's not specifically COVID identified for fiscal year 25. There may be some there. That's very much a possibility. Yeah, I just think, you know, as far as especially the immunizations part, I mean, that is a mandated service. So if we didn't have the funding through this funding source, we still have to do it. We are required to do it. So that may mean asking counties for additional local appropriations if we did not have this specifically identified line item to cover those costs.
Dan, can I add to that line item? The immunizations up until this year, they were covered, the cost of them was covered by the state. Now the state is done with that and they're saying, we are not going to cover the cost of immunizations anymore. You have to cover it yourself. We have to go directly to the manufacturers to get those immunizations now. So the cost has been transitioned over to us. This is the dollar amount that we are provided to purchase those. I'm not sure we know exactly how many it'll purchase, but it's on us now. It's our responsibility.
That's correct.
Is Shannon, Mr. Mapes asked if this money was already in our possession. Have those funds been distributed to us already?
We've received all of the letters saying, yes, you have been given this money for this year.
Okay.
We accepted the contracts.
All right. Thank you. Any further question or comment regarding the specific COVID funding motion that Mr. Rubing stated?
Mr. Chair, if it's okay, Scott, can I add
Certainly.
to Dan's comments? Specifically, especially with the wastewater program. I mean, that's a surveillance system. And, our country has a surveillance network for all sorts of communicable diseases. The idea of testing wastewater for the presence of diseases is interesting. It's pretty new and it's exciting. It might be a better way to provide surveillance. And I think what's neat is that typically these are done in big urban areas, and we're one of the few areas where we have this surveillance in place. In rural northern Michigan, it provides funding that really helps solidify a regional laboratory that benefits all the citizens of northern Michigan. It's not just about testing for COVID. COVID is kind of our what we're looking at right now, but we're also gaining knowledge and experience. And what I see is this could be something in the future that is a model for surveillance of all sorts of illnesses. So it's really, I think, an exciting opportunity in the fact that we're getting this funding. We're doing this, on behalf of a large region, and it's a part of a national surveillance network that I think, is beneficial in many ways. And so you have to look at the long game there. As far as the school nurse program, I think, Dan kind of said it, yes, we know that this money is time limited, but it's allowed us to provide school nurses for a lot of our communities that didn't have one. I think many people will remember that schools used to employ nurses themselves. They'd have a school nurse. A lot of buildings, or certainly school districts, most had school nurses, and that all went by the wayside over the last 30, 40 years because of a lack of funding. The schools didn't have the ability to have a nurse without supplemental funding or support from other ways. And when this COVID money came in, and this HRA money, we immediately had a conversation here and saying, COVID isn't going to be the primary thing on people's minds. It's not what's going to be driving what the school's needs are. So how can we take this money that, it's for COVID and we have to provide some, COVID information. How can we take this money and make it really something that that can be utilized to provide a holistic school nurse presence in the schools. And I think we really have done a nice job of doing that. It's something that we've done very collaboratively with the communities and the schools. And just to, reinforce what Dan said, these were schools that said, we want a school nurse. We want someone in our school community, in our building to help children. It might just be, cleaning up, a scrape or an injury on a playground. It might be a nurse who can assess a child who fell off the monkey bars and say they need to go to the doctor, or they don't. They can simply sit in the school nurse room for a little bit, get an ice pack, and then go back to school. It might be a nurse working with a child with chronic illness, with asthma or a seizure disorder or diabetes, and they help that family and the school work with that child to keep them as healthy as possible and to handle minor health problems before they become major. And the whole idea, the whole purpose, obviously, is to have healthy kids and to keep those kids in school. And school nurse programs, I think, can help kids spend more time at their desks learning. And that's really the primary focus of this. We know that the money is time limited, but what it's going to do is hopefully buy us some time to continue these programs. The schools are saying they really appreciate it. They want to have a nurse. They want to continue this. And it will give us time to hopefully find alternative ways to fund this, to get us back to where we were for many, many years. Schools had nurses. We're trying to just, again, keep kids healthy and keep kids in school.
Thank you, Dr. Myerson. Mr. Turnbull.
Yes, Mr. Chairman. After speaking to quite a few members in Otsego County, I talked to them specifically about the budget and had a few people look at it with me. Just due to my handicap, have them help me read it and what do you see in it that I should be seeing? And asked, what areas do you think we can improve upon? And almost unanimously, they all reflected exactly what Commissioner Rubain said. So because of the people that I've spoken to, I support Jairus and Commissioner Mason as well in what they said.
Okay, thank you. Is there any further comment or discussion regarding Mr. Rubing's motion? Ms. Levanway, go ahead.
I would just like to know, how many wastewater treatment centers do we have in our region here?
How many total wastewater treatment centers, or how many that are participating in the sewer network?
Yeah, in the sewer network.
We have 4.
Where, Mansalona, who are they all?
Mansalona and Bel Air we tried to get them on board, but because of their staffing, they had to have somebody there, and
Yeah, that's
somebody's
not happening.
somebody's not always there.
They're broke. Okay, go on.
Yeah. So that was somebody that we wanted to have on board, but couldn't. But we have Charlevoix, Petoskey, Gaylord, and East Jordan, or Otsego County.
To 5?
4.
Mansalona, Charlevoix, Gaylord, and East Jordan.
Right.
And
Not Mansalona, Petoskey.
Not Mansalona.
Yeah,
Petoskey was in there.
so the ones that aren't in there didn't want to participate.
It was more that they didn't have this, because they had to
Staff.
collect the sample and had to be there at a certain time. And the way that their model is, they come and go. They
and
don't always,
have the staffing.
they
to
don't
do
always
that.
have somebody on site all the time. We did have, Bel Air was participating for a while, but it was, we ran into that issue where we couldn't, they didn't have staff there.
So
all
there's
the time.
nobody in Antrim County,
No, not currently. We tried.
but there's Bel Air and Mansalona that could have if they had staffing.
Correct.
Okay, that makes sense.
Yeah.
People don't realize what wastewater treatment centers do.
Yeah. Pretty important work.
Is there any further comment or discussion regarding the motion? Mr. Mason, go ahead.
Chairman Hankins. I have a little concern. The language we use sometimes ramps up over time. We're hearing more and more, but we have drone surveillance. We're talking surveillance through testing of septics. I wouldn't be surprised if most, if not every home has had some COVID in the past few years. And so, what else? I mean, we're looking at the health of children. And if we can't have healthy children, what is to be done with these children? I question, we're spending money on testing sewage, which probably most of us at this table in this room have had some form of COVID already, certainly myself. It was a blip. And we're big on testing for flu shots. I've never had a flu shot, and in the last 25 years, I've had the flu once. I understand people get the flu after having the vaccine. So this all ties in with where we're going with this kind of money.
Thank you.
Just to clarify, I think I heard that the money that's being budgeted isn't just testing for COVID, and we're taking advantage of the money that we're given from the government to use for COVID. We're using it to test for other things other than COVID.
That's the long-term goal.
Pardon?
Yes, that's the long-term goal, is that we would test for other communicable diseases.
It's more or less getting, I mean, because it was brand new, getting the lab set up, and we were testing for COVID. And the idea now is that we're going to shift into other testing for other communicable diseases. I mean, the big, a huge expense for this is having qualified, very scientific staff that are running a molecular biology lab. The equipment is very expensive. It's digital droplet PCR is what it's called. Polymerase chain reaction, I believe is the acronym there. And it's very technical, detailed. And part of this whole system is when this started, it was looking for COVID and getting the network set up, basically.
So the question, I guess, mainly for me is
Mhm.
we weren't doing any testing of wastewater treatment plants prior to COVID?
No. No,
Okay,
we're not.
so we're going to be footing the bill to keep these wastewater treatment plants going after the COVID funding ends, correct?
No, the wastewater treatment plants they were just providing us a sample, and then we're doing the rest of it on our own.
I understand that, but we weren't
Right.
doing that before COVID.
Correct. No, we did not have wastewater surveillance before COVID. This is brand new.
So this is just something, but we're using COVID money to get us kind of like our feet off the ground and get moving with a program that we plan on continuing to fund. We're
That's
going to have to find different ways other than COVID to fund
Correct.
it, correct?
correct.
Okay, just curious.
I don't think the costs are going to be as high because the big upfront cost is getting that lab up and running. We've made a lot of purchases that, as Dan rattled off all the technical equipment that I couldn't tell you the name of, but that's where the biggest costs are. So once we've got that behind us, we can do it. Then it's just a matter of, well, what do we want to look for now? We're past COVID. We're going to look for flu. We're going to look for something different.
Well, would we, and I understand where you're headed there, Don. This is, right now it's funded by the government, but down the road, we have to fund it.
Eventually,
I would
or
say,
somebody's going to have to pay for it.
well, I would say that the systems that are currently being tested perhaps need to be funded by their own municipalities. So if Petoskey wants to have our health department test their water treatment or their wastewater treatment, then they would pay X number of dollars to do so. If Charlevoix wants to do the same, if East Jordan wants to do the same, it's kind of a pay to play thing. We have the lab facilities available, but I don't know that this board needs to fund that. If each individual municipality wants to have their system tested, they can pay us to do so.
If that's going to be our goal for the future, then I don't have any problem with that.
My point is, I understand you're talking about the revenue stream.
Sure.
That potentially creates a revenue stream for our environmental health division instead of us having to fund that. Let the folks who are utilizing the system pay for it.
Yeah, and that's really, I mean, part of our strategic plan for sustainable, keeping the lab sustainable, basically. I don't know at the end of this funding cycle does the state find value in the wastewater surveillance to the point where we want to expand into other arenas like flu and RSV? That's been kind of on the horizon. so
Well,
to
if
speak.
these funds expire in July of 2024, I think that's the next budget year conversation.
Oh, absolutely.
Yeah.
Yeah, absolutely.
Do we provide that service? How is it funded? Again, I think it's
Right.
a pay to play. That's maybe a terrible.
And it's the same thing with our vaccines as well. Remember, there was a year ago at the there's a veteran fair down in Grayling. The health office was handing out, or doing vaccines there. And I was talking with one of the gentlemen who I met with later who received one of the COVID vaccines. And he was charged for the vaccine, which to him was no big deal. But that also being said, I mean, so if we stop it here, which I mean, it's going to stop, as you said, the funding does. I mean, it doesn't mean that it's over. I mean, there's always way, you're pay to play. I mean, if you want a vaccine, you can pay to get a vaccine. I know where you can get them. I mean, you come to these guys, so that does make sense. I do like what you're saying though, Scott.
But
That makes sense.
I think in the vaccine department, we're required by state law to provide those vaccines.
Correct.
And I understand what you're saying, Jonathan. If somebody has private insurance or something, or they want to pay for a vaccine, they can do so. But for those who desire the vaccine that aren't able to pay for them, I think we are required by state law to make those available. Is that correct?
That is correct.
Okay.
And that, when we were charging, we were basically charging an admin fee. We weren't charging for the vaccine at that point. Now now it's different. FDA has approved the COVID vaccine. So now we have to purchase it. So, and how much we purchase and what that's going to cost is, we're determining that, but it's a big cost. It's a large cost.
Thank you.
Insurances are paying for, if you have private insurance, they do cover, they likely will cover. Medicaid will likely cover, but we're still kind of putting those pieces together now. But yeah, there is a large cost for purchasing that vaccine.
Thank you. Are there any other thoughts or questions regarding the motion? Mr. Rubin, go ahead.
Yeah, so the sewer network, am I correct that we have 4 places that we're testing? So it's costing us $250,000 per place?
4 wastewater treatment plants. So
Right.
the rest of them, we have long-term care facilities and schools where we're doing testing twice a week, or sampling and testing.
How many locations?
Right now we have 19.
So you take 20 into $1 million. That's really expensive.
I mean, that's right. I mean, like I explained, it's not a cheap, there is some expense to doing that service. It's wrapped into the technology and very technical laboratory procedures and everything else. And that, that funding was coming to us to basically do surveillance, like Dr. Meyerson was saying regarding COVID. Very useful tool. And like I said, we want to carry that work on. We have built the infrastructure around it. How we do that beyond, if this funding ends and there's no other source to do that, we're going to have to figure that out and make adjustments as we go. Because we need, it's not cheap. You're right about that.
Yeah, I mean, I guess my point is, it's been said a couple of times. All of these here are time limited. We can be proactive and limit it today. Or we can just kick it down the road a little further and say, well, we're going to deal with it in June or July or September.
No.
I don't see any change, $2.5–3 million per year more in the health department. And this is one way to curb spending and control the government a little bit. If we don't, he who gives up a little liberty for security will end up with neither liberty nor security. This is a government. And if we don't limit government, the government will control us. And this is a small way to do it.
Ms. Levanway, go ahead.
I just want to make sure, is this all the immunizations for COVID? Well, they're making immunizations with COVID and flu and everything in one, aren't they now?
Yeah, that will be combined after.
So if we eliminate this, we will have to pay.
We have to do this.
Yes.
Yeah, it is.
So if the
mandated
health department has
service.
to pay, it's going to be pushed onto the counties.
That's
Because
only,
how else are we going to do this?
Right.
So the appropriations are going to be a lot higher. It's just going to come out of your county taxes. We've went through this in our meetings over and over and over. Every single thing that gets cut is going to come back to the county taxpayers. It's going to have to be increased. So you can cut anything you want, but it's going to come back to the local people to pay higher taxes. Now, let me understand something. I want to make sure I understand this. Gaylord did not make their appropriations last year. They did not pay their appropriations.
they paid their appropriations. It was just
Not
a
the
little bit
required.
less, right?
Little bit
3% less, I believe.
Okay.
Right.
So they paid 3% left. Have we decided to do anything about that this year?
So when this has happened in the past with appropriations that are not fully funded, we add a surcharge to the environmental health fees. And then that makes up the difference.
So the local taxpayers have to pay higher fees. So if you're using it for the health department fees, now the taxpayers are being taxed twice. Because they have to pay in an appropriations plus when they use the fees that you're charging them.
Yeah, I mean, there's a surcharge added to the fee.
So why
So
would
it's
we
a
cut,
user.
why would we cut things that are required for us to purchase? And then tax our people instead of getting the money from the government that's willing to give it to us? Doesn't make any sense to me.
Mr. Chairman.
Mr. Mason.
The user pays that fee, not every taxpayer. It's so unfortunate it has to happen even that way. For the sake of the health department. But essentially, this is more government growth. It started with COVID. We don't want it to end at the end of COVID. It's going to continue on and it will become much more costly. It won't be reduced fees in the end. There will be other things that add into the picture and the cost of the labs won't be the end of it. For something that takes care of itself, we're looking to test for who knows what, but it's surveillance. It'll fix everything.
Okay, are there any other comments or discussion regarding Mr. Rubing's motion? Okay, so a yes vote would be to support the motion and remove the COVID funding that's detailed in your budget. A no vote would be to not support that motion and to leave the COVID funding that's detailed in your budget in place.
Could you read that motion again?
The motion by Mr. Rubing was to remove the $2.154 million in the COVID funding and replace it with all zeros. Did I properly restate that, Jairus? Okay. And again, a yes vote would be to support that motion and remove that that funding and replace it with all zeros. A no vote would be to leave those funds in place in the budget. Mel, can we have a roll call, please?
Commissioner Henkins,
No.
Commissioner Aaron's,
No.
Commissioner Levanway,
No.
Commissioner Chamberlain,
No.
Commissioner Mapes,
No.
Commissioner Turnbull,
Yes.
Commissioner Rubing,
Yes.
Commissioner Mason.
Yes.
Motion fails.
That's 5-3. Thank you. All right, any further questions or discussion regarding the proposed 2024 budget?
I do
Mr.
have a
Mapes.
question regarding the fees and collections. How much of the, being a part of this board, not knowing much about the health department, but I've always heard that it's, and amongst all the discussion and stuff that we've had in public comment over the months I've served and the meetings that I've been attending and stuff like that, that that we're here to serve the indigent, and that's not true. Obviously, because we collect fees, you know, in the amount of over half our budget. Everybody seems to talk about, we need to be here. What about the kids? And what about the people who can't afford health care and this and that and the other thing? Well, obviously over half of the people we serve are able to pay for it in one way or another, either through Medicaid or another form of income. You know, and then we talk about mandated services and so forth. I don't know, as a board, you know, if we're supposed to support the health department providing mandated services, I don't know what we can do as a board to reduce costs, so long as mandated services keep going up and up and up and up and up. But am I correct to assume that over 50% of our revenue comes from fees and, you know, people that are able to pay?
Yes and no.
Yes and no.
How's that for an answer? That's very
Yeah,
unclear.
I figured.
That's
When
a
you
typical treasurer type answer.
cut from the same cloth, what can I say?
Okay.
No, let me explain a little further when I say that. So if you look at our budget, you have to remember we have a dental piece that most health departments do not have. The dental piece is what drives most of those fees and collections. So if I were to take that out of the total for fees and collections, the dental fees and collections alone are $14 million of the total. Hold on, I got to flip the page. $17 million. So for the health department itself, it's $3.5 million that we have in fees and collections. The majority of this is in environmental health. We have septic permits, we have well permits, we have food permits, licenses for those. That's where you see the majority of it. There's a piece in family health too, and there's a piece in community health. So does that help clarify a little bit?
I have something I can add too.
Sure.
So the 14 million that she's talking about from Dental Clinics North. So we think of Dental Clinics North as a safety net. So these are people that have Medicaid. So they do have Medicaid. So Medicaid is paying us. They're not bringing this out of their pocket. These are Medicaid beneficiaries that are coming to our dental clinics to get dental care that they otherwise wouldn't get. So we're receiving that money in fees and collections as revenue back from Medicaid. And they just increased that for the first time in the last 30 years. So for us to be able to even make revenue of $14 million from Dental Clinics North, we're seeing astronomical numbers of clients that are coming in for dental care. So it's not that they can come in and, you know, they have private insurance and we're making a bunch of money off them. We're just seeing such a sheer volume, and the Medicaid increase, finally, the rates increased. So we're able to see that as generated revenue to then spread back to where we need to. Does that make sense?
Yeah.
Okay.
I would just add one more thing to that too, is, which is an important piece. As that happens, we have something called the Northern Health Plan, which we have not been able to fund over COVID in dental. So now that more increased revenue has come from increased Medicare reimbursement or Medicaid reimbursement, we're going to be able to fund that Northern Health Plan. So those that, you know, maybe can't meet the entire expense that's provided through Medicaid, or that just don't have insurance at all, will have more of a sliding fee scale that will help those individuals.
That's through the health department?
That's through, Dental
Yes.
Clinics North.
I
So
think
the
the-
dental clinics that were.
I think the other thing that you're not bringing up is that a lot of private dental people can't find employees. So they're not taking people on Medicaid anymore. So now they have to find a place to go.
Well, I think
And
that's always.
creating all this from
Yeah.
COVID, because people weren't going to the dentist during COVID, and now they're all backlogged, so they need to go. So that's why it's such a boom have increased with people.
I think for private dental providers, Medicaid is a beast to deal with. Okay, so we have a unique, very specialized staff that know the Medicaid billing in and out, because we've been doing this for so long. we know how to do it. And there's very few private dentists, they usually cap the number of Medicaid patients that they'll see
Mhm.
because it is such a arduous task to do.
But
all
they're
the
not doing
paperwork.
it anymore because they don't
Or-
have the staff.
Or maybe they decide not to do it. I don't know, but I do know that, that's why people are coming to Dental Clinics North is to get those services. If we had private dentists out there that were able to do it, I would certainly, I think we would certainly see that our numbers would be decreasing, not increasing. Another important thing, I guess, to say about fees and collections too, is that, from a health department standpoint, if we're able to, bill private insurance, that keeps, our costs, we're bringing in revenue that way, and that helps, keep the local appropriations in check and other, costs that may be coming to the counties, to help support those services. So that is something that, I think over the years has, been refined and, has been leaned on a little bit more as, we all know in local government, budgets are tight. It's hard to find the revenue. Costs are increasing everywhere. So we're just trying to be innovative and find ways to, capture those fees, capture that revenue in a different way.
So the fees and collections, 17.5 million for this year. 14 million is from Dental Clinics North, is that correct?
Correct.
And the other 3.5 million is mostly from environmental,
Mostly.
well and septic.
Right. Well and septic permits, food licenses, campground permits, pool permits, things of that nature.
It looks like on the first page there where all the pretty colors are. Total environmental health division is 1.4, total family health is 1.2, total community health is $804,000.
And actually, if you look at the budget last year, the environmental health, which is 2023, was more than what's budgeted here. And if we have all those townships that are now going to have to be tested for time of transfer, that might be a low number.
Yeah, that could.
So you might be
go up.
budgeting lower than what it could be a lot more.
I'm hoping that doesn't happen, but
Well, nothing wrong with that. It's just safe.
not the townships. I'm talking about the statewide.
To clarify on those fees and collections, to go back to your original question, Commissioner Mapes, those fees and collections that you see in family health and community health, those are also Medicaid payments that we're receiving. So again, that's not somebody's out-of-pocket payment typically. That's usually a service that we're providing and we're being reimbursed for it through Medicaid. That helps.
Is there any other questions regarding the proposed 2024 budget?
I have a question on page 2 of 16. Regional Planning Division, $250,000 from the Michigan Health Endowment Fund. I'm wondering
Hold on,
what,
let me catch up with you.
Yep.
On page 2?
page 2, grant funding, kind of in the middle of the page, regional planning, under the Regional Planning Division.
Sure.
Okay.
I'm just-
I need to take a phone.
Yeah, we can, ladies and gentlemen, let's take a 5-minute recess.
Oh, I got one today.
Okay. I heard the recorder start, so we are back in session, ladies and gentlemen. We have any further questions or discussion regarding the proposed fiscal year 2024 budget? Mr. Rubing, we kind of stopped on you. Can you restate your question, sir?
Yeah, it's under the Regional Planning Division on page 2, grant funding, $250,000. I'm wondering what that's for.
I'm going to defer that to Holly because she
Sure.
knows it better than I do.
So the Michigan Health Endowment Fund Behavioral Health Initiative is what that it stands for. And that's an initiative that is working to bring mental health providers to rural northern Michigan because we have such a shortage of mental health providers, kind of like we have a shortage of dentists and dental hygienists and all of these professional type positions. So what that initiative is doing is working to bring not only social workers, therapists, psychiatric nurses. I know that they had the psychiatric inpatient floor that they couldn't staff because they didn't have any psych nurses. So this initiative is really working at bringing behavioral health providers to our region.
Okay, I understand. I would just point out that part of the thing we just looked at in the COVID funding was workforce development, which is basically the same thing. And I'm also on the mental health board, and they're getting, I think it's $250,000 to do the same thing. So we got all these government agencies that we have shortages of workers. Well, every private employer has the same problem, but now we have the state government who's giving $100,000 here, $250,000 there, $250,000 there, all to grow their workforce. It's counterintuitive. We're just competing against ourselves and we're not solving anything.
The Behavioral Health Initiative has over 200 partners in the northern part of Michigan that is working together to leverage all of the funding that everyone's getting to make the most bang for their buck.
And
It
do
is a
they charge for
collaborative
their
effort.
services?
I'm sorry?
Do they charge the mental health therapist, psychiatrist, when people come and see them, do they charge for their services like a regular doctor's office, charge Medicaid or Medicaid?
It depends on the type of clinic or hospital setting or school-based setting. This is an initiative to bring them not just to the health department, to all the region.
My next question is on page 6. Family Health Division, 383 harm reduction services, $70,000. I believe this is the money that funds the free needles and syringes in Antrim County.
Okay, I'm on Family Health Division. Which section are you in again, Sheriff?
383, it's harm reduction services. You go down a little ways.
What's the
Okay,
question?
thank you.
Question?
Is this the one that gives free needles and syringes in Antrim County?
This is the syringe service program, yes.
I would like to make a motion to eliminate that, Mr. Chairman.
Could you tell us more about it?
Sure. The syringe service program is what we call harm reduction. So public health is in the business of reducing communicable disease because we know that once a person is infected with hepatitis C, it's very costly to the community that they're in to treat that hepatitis C infection. So one of the most common communicable disease when people are using injection drugs is hepatitis C and HIV, which is very costly. So in Antrim County, we have a syringe service program and we help people learn how to use injection drugs efficiently and safely so that they can themselves learn how to come to recovery at their own terms. So we act as a safe place where they can come, they can confide in us. We offer basic health care services.
So you're
They're-
educating them.
Yes, 100%. And we have a really strong relationship with Catholic Human Services to refer them to treatment if needed. And I have a handout, actually. I kind of thought this may come up, but in 2022, so from January of 21 to December of 22, we gave out over 16,000 needles. And we give them out, they bring them back. And what happens is clients come in and they typically take syringes that are for more than just themselves. So what we call the secondary exchange. So we are not promoting drug use in any way. What we are doing is trying to help the people in our community that have an addiction, that have an illness, to help them get into treatment and on the way prevent them from getting hepatitis C and HIV, which is very costly for taxpayers to pay.
I would just add one more thing to that is, part of that is collecting the used needles, because that has been identified as a public health issue. Needles on playgrounds or on the street or whatever, and just having the general public come into contact with those. So as part of that, they do get clean needles, but they also get a sharps container. So they basically put their used needles in that and then bring it back, and we take those sharps and they get disposed of properly. And I think,
And that's a grant, correct?
that funding comes from the state.
It's a state
Correct.
money.
Correct.
Is that just Antrim County or is that all the 4 counties?
I'll let,
You know?
I think, the money comes to the health department, so it could be in any county, but our current services are primarily in Antrim County. And I think, and I know I can see Commissioner Rubin when he brought that up. I can tell you all when the state approached us and said, they identified, certain regions of the state that have that were higher risk. The CDC looked at counties across the country that were at higher risk for an outbreak of HIV or hepatitis C, specifically looking at HIV. And this all stemmed from the county, a small rural county in Indiana that had a large outbreak of HIV related to people who injected drugs, illicit drugs. And they identified us as a region that had risk factors based on, opioid prescriptions and hepatitis C rates and everything out. That we were a rural area that had a risk. Specifically, there were some hot zones around in Antrim County for sure. And I can tell you, when I started this job, this is not something I look forward to doing. I didn't understand it. I said, why would you want to give needles to, it's like giving shot glasses to an alcoholic. I didn't understand it. And I wish we didn't have to do it. I wish the problem would just go away. I never thought we'd have to be dealing with people injecting drugs. I thought that was from the 60s and 70s and heroin and all that, and we were over it. But I think if you talk to any of our first responders and our public safety officers, it's an everyday occurrence where they're having to revive someone with Narcan, or they're dealing with people who are in this vicious cycle of addiction and dependence, and that's just our reality. But syringe service program is a lot more than, is not just needle exchange. It is harm reduction. It's a door. It's meeting people where they're at, and maybe they're not quite ready to get into treatment, but they'll come see us and they can start, and they develop this relationship with our staff, with our nurse, and that over time can help lead them to getting the treatment they need to break that cycle of addiction. But so it's a lot more than, it's not just, it's getting people into care that helps them care for themselves. But there are good data on syringe service programs across the country, and they do reduce, when you just look at needle exchange programs, they reduce needle stick injuries among first responders and the public. So by having this program where they're bringing their dirty needles in and disposing of them reasonably, there's a up to 66% drop in the number of people who have inadvertent needle sticks, which if you're a first responder or a public safety officer, I think that's good news. It saves money, testing linked to prevent hepatitis C infections that are treatable but very costly. Every time we can prevent a hepatitis C infection, we're saving thousands of dollars. The studies have shown that SSPs reduce new HIV infections, viral hepatitis infections. That's really what our role is there. We're trying to prevent communicable diseases, which is one of our mandated things to do here as a local health department. When they look at clients that are in syringe service programs, they're 5 times more likely to enter a drug treatment program than non-clients. So when they start that process, they're more likely to then actually enter treatment. And I think a big thing that's important to me to know when we started this program is, does it encourage people to use drugs? Are they more likely to shoot up because we have this program? And I think that is clearly been shown that syringe service programs do not increase drug use. in crime. Read what? These? Oh, so some of our facts, we've given out over 16,000 sterile syringes. We have 45 different clients. 239 individuals who receive secondary exchange, meaning the clients that come see us then can help distribute it. We've distributed almost 300 biohazard containers, the Sharps containers, to keep the needles off the grounds and in the parks and everything. We've also distributed, over 600 Narcan kits with 73 to date successful reversals, people's lives being saved. We've referred 5 people to substance use treatment and countless number of referrals to community connections. This program was passed by the Board of Health. This wasn't started without Board of Health approval back in, was it 2018? I can't remember, or 19. But this was brought up. There was a whole presentation, and the Board of Health had some of the same questions that I'm sure some of you do. And after hearing and learning more about it, they did approve this program to be done at the health department, as well as allowing other agencies to provide this program as well in Emmett County specifically at that time. And again, what they don't do is they don't increase drug use or crime in an area. So I think that is a reassuring thing. So,
okay, before we have any further comment, things kind of got away from us there. Mr. Rubing made a motion. Before we have any further comment or discussion, we need to have a second on that motion.
Second.
Seconded by Mr. Mason. Now, Mr. Mason, you had a
Thank you.
question.
To answer Dr. Myerson's statement to no increase in crime. The Otsego County Sheriff has admitted we have 2 methadone clinics, maybe 3, but I know 2 that operate. Recently talking to someone says traffic into those clinics is all day long. She works near one of those clinics. And Sheriff Nowicki would tell you that we do have increased crime. He wished we did not have the methadone clinics. An individual who asked one of the nurses that hands out the methadone shots, asked, "What kind of recovery rate do you have?" Her reply was, "We don't do it for their recovery. We do it to give them a clean needle." So this is conflicting. And we do have a lot of crime in the Gaylord area. These people are filling the jails. We don't have enough room for the people that in our small jail anymore.
we don't do the methadone clinics. We don't do those. So when I'm talking about, I'm talking specifically about syringe service programs that are taking care of people that are providing needles to people who are already injecting illicit drugs. Methadone is a pill that they swallow. So if they're taking methadone, hopefully they're not injecting.
It's similar. In contrast, they're similar, are they not? You have
one is a harm reduction program. The other one is a drug treatment program. So they're similar. They're dealing with similar issue, essentially the opioid dependence for sure. That's what they have in common, but they're different programs.
These people, a lot of them use the buses. They can't drive, or maybe not all of them are in that situation. But it very well possibly could be extended over into Antrim County. But it has drawn people to the clinics here in the Gaylord area, or there in the Gaylord area, and I see similarities. We're not. You say I don't know what your recovery rate is. They have basically 0 for recovery with the methadone clinics. It's just replacing one drug with another. We're spending a lot of money on these things. And I think our commissioners board, if I'm not mistaken, about 2013 approved of methadone clinics. Either within the county or the city did it. I'm not sure which, but one board or the other determined that we could have these if it would be good for business. It's been very costly.
Any other discussion regarding the motion?
Yes, Mr. Chair.
Mr. Turnbull.
I'd like to ask, this is Dr. Myerson speaking. How many people have received the free needles this year? again? Said 200 something?
I'm not sure what it is this year. I can get you that data, but the one that we were referring to was since the inception in 2020, we've given out over 16,000 clean
Makes sense then.
syringes.
And this says 45 different clients on the
Okay.
same sheet that you handed out.
Yes.
Has there been, is there any information that discusses whether there's been an increase in people coming in and getting the needles or a decrease in that? Over the, I mean,
Well, over
since
time, we have
2020, I guess?
increased the number of clients that have come in because they trust us to help them with whatever their needs are. We help them with all sorts of things. Maybe they're coming in and getting needles and having secondary exchange, and it's the middle of the winter and they don't have socks on. Or, we referred them to other programs within the health department via community connections to really connect them to what they need. And, like to Mr. Mason's point, the methadone clinic, that is an active recovery type treatment where people can get their lives back together and can pull up their bootstraps and start rebuilding their lives after they've come out of active addiction. That's the whole point too of syringe service, is to decrease barriers for them to be able to come out of that heroin addiction or whatever drug they're using to become self-sufficient members of society of that county so that they can, contribute as a citizen as a whole.
I would like to add just one thing, as was discussed before. I mean, this really came about in his health department program and comes through Michigan Department of Health and Human Services, mainly to prevent hepatitis C and HIV infections. Because, as was mentioned, I mean, that's part of our public health charge. If we can prevent disease, that we need to do that. We need to try to do that. And this is an area where it's been proven that it does work. And that's really, what this surrounds. I mean, the added benefit is what Holly was just talking about, gaining some trust and hopefully peppering with them, those clients with information about and their terms when they're ready to step into treatment. But the primary goal of this is to prevent hepatitis C and HIV infections, which is very costly to society and is, really kind of goes back to that mandated charge that health departments have, is to prevent disease.
I think it says right in here, one patient can cost up to $400,000. A lot of money just
Right.
for one.
Well, okay, I'm having a hard time getting past 16,000 sterile syringes for 45 different clients.
So of the 45 different clients, some of them are using, they're taking syringes for other people. That's what secondary exchange is. So maybe they come in and they only need 25, but they take 100. And I don't know if Melissa wants to speak too, because she runs this program.
I do actually, if that's okay. So part of what I want to explain is that the program, the funding that we get from the state is for so much more than those needles. So we are trying to reduce harm in all aspects of their life. So, providing some toiletry items, because injection drug users also are notorious for having wounds, and they will not go to the doctors because they don't have insurance or they don't have a way to get there, or they're afraid to go there. So then we see that same, they might not have Hep C yet, but they're waiting to go to the emergency room until it's bad. And then we're paying for that as well. That number of needles doesn't change because we're giving clean ones. Those needles are yes, it does, because they're just reusing them and then they're dropping them off at the park and our kids are picking them up. This doesn't change.
Hold on. Has there been a documented situation where kids are picking them up?
Yes, in the Sioux, they have talked about multiple cases where they're finding them in parks where kids are playing, and we're trying to prevent that. So these people are using regardless. I think that's really what we want to bring up. And we don't know how many people these needles are getting to because so many people are afraid to come to anywhere near. And so those people who we've built trust with are saying, okay, I'll take these so that they're not reusing the same needle. And I know, like 1,000%, I know it's hard. And
Mr.
for
Rankin,
me,
do you see the number of lives that have been saved with those Narcan kits? As a police officer, how many?
I have
overdoses
seen a
do you
number of
see?
people. I've also seen people who have been revived 3 times in a day. The same person.
Is their
that
life
have been-
worth less just because they had to be saved?
I'm not saying that. Is it government's role to enable? I'm sorry, I look at this as an enabling step. I agree that we should be promoting public health. But government cannot fit every role for someone's life. There has to be some personal accountability and responsibility somewhere. Is there any further conversation or discussion regarding the motion? Mr. Trimble, was that a hand up? No?
Oh, no, I was just, I mean, I totally agree with you. There's a, old phrase, there's 1,000 ways to skin a cat. Is this the best one? I understand you're preventing kids from having needles, or finding them in the park is good, but they can drop off their needles at the health department facilities, can't they? Oh, they can.
seeing that this is coming up because we just had some questions from, there was someone that had moved north. There actually are not nearly as many needle drop places as there used to be in our counties. It used to be you could do it at the hospital, you could do it at all sorts of places, and we just I just had to look it up because somebody was looking for diabetic, where to drop off diabetic supplies. And so that's part of, like, we don't have unlimited sharps that anybody can bring to the health department for dropping off anything in any of our counties, because we pay per sharps container that we have to have taken care of. So that's our needles, all the things. And so a decent chunk of this funding is buying those sharps containers that people in the community can use then to dispose of their needles properly.
Okay, that makes sense, because all I was hearing was we're handing out 16,000 needles, but they can't bring them back, so we're handing them out, but then what are they supposed to do with them? But so sharps containers,
Yeah,
Okay.
a large.
because otherwise
amount of
we're
the
fueling the
70,000.
problem even more. I mean, we're just, flooding inundating the system with needles, and if we can't pick them up or we can't dispose of them, I know Crawford County, they have a whole bunch of different disposal places at the sheriff's department and a few others. But maybe that might be something we could look at doing to the future.
So what's the breakdown on sharps containers versus syringes? Out of this $70,000?
So the amount for syringes is actually really low. I don't have the total with me right now, but could get that. Because it's in the funding, that most of the funding actually has to be spent on other things. Sharps containers, the education, the clean supplies that aren't syringes.
Just a question regarding the $70,000. When you do the numbers, it looks like who pays for the syringes? I don't see much money left for syringes and sharps containers once you pay administration and all the overhead out of the $70,000. Where's that money coming from?
Yeah, so it currently this year, the supplies and materials are 7,640. Actually, most of the needle supplies don't come out of that because there isn't enough money to pay for what actually brings these people to our door. We're paying for all the things that we're giving them besides that. So the sharps containers, the education, the clean supplies that aren't syringes like alcohol pads or those sorts of things. The syringes often have to come from other sources. So we look to other organizations to help pay for that.
So you're handing out needles, but is there any way, can they return those sharps containers to you, to your office? Okay, so they have a way in Antrim County of disposing properly of those needles and syringes.
Yes.
Are you the only place that they can bring them?
I don't know that for sure in Antrim. It was actually at Seago that I was doing the research on for a client. But I'm not sure that there are other places in Antrim County. I know at Seago didn't have any listed.
Do any of the local health department facilities in any of our 4 counties take in syringes like this?
Do you mean
Can somebody in
elsewhere?
Charlevoix go to Garfield Street and drop off a sharps container?
I'm not sure. I don't know.
No, it's not. It's not part of our regular services. So there's not funding except for through this program to pay for getting, all of our funding is like allocated. We can't use it for whatever we want. And so that's not a part of any of the other services that we have.
I will say once in a while, I know that the sheriff's department may have some. And they ask us to take care of it, and it may just be a few. I have heard that. But we don't have a regular setup where people can bring us dirty needles.
So what does the health department do right now with its regular immunization needles?
Well, we have a service that does that because we create medical waste, right? So we have to have the service to pick up that. But there's a cost to that and whatnot, but we don't have a drop off for the public to bring us dirty needles, basically, at every site. Yeah, I mean, it's kind of comes down to funding, I guess, for that and storage and what that would look like. But I do know we have had requests from, like I said, the sheriff's department or, somebody found some needles, so we've we've taken in some in those situations just to be helpful. But it's not, by no means a regular, service that we have.
I would be much more in support of this $70,000 if people could return their needles and we not supply them new needles or cleaning supplies. Because to me, that looks like enabling. If we are disposing of needles, that looks to me like a public health service. Mr. Rubin, you had your hand up.
Yep. I was just gonna point out that this program is patterned after the state of California, who tried this 20 years ago. And I don't know if you've seen anything in the news from California the past couple of years. There's actually a gentleman who's from California that lives in northern Michigan now. And he will tell you that it definitely enables, and the amount of needles that still don't get disposed of properly continues to increase with the number of people that continue to use drugs. This is unfortunately another example of us trying to fix a problem and we make it worse. And I would also add that we all have a sin problem and they need to be forgiven. Jesus promised us that anyone who comes to him and confesses his sin will be born again. And this is a symptom of a spiritual problem in our region, unfortunately.
Can I just say one thing? And with all due respect, we do have, I mean, different numbers that show that this is effective for preventing HIV and hepatitis C infection. And again, that is the main focus of this. We are a public health agency. And I would say that, you know, the clean needles, although I get the argument, I understand where you're coming from about talking about it being enabling. I can see that, and I know it's difficult to wrap your head around. But studies show that the clean needles do prevent transmission of infectious disease, and that's really what we're talking about in the cost of society of dealing with those type of things. Yeah, and yeah, saving their lives and hopefully hopefully they have another chance to pull together and move on and be productive members of society.
Mr. Mapes.
Yeah, this is just Antrim County, correct? Did Dr. Meyerson mention that there's other counties are doing other things?
There's other counties throughout the state that have similar
I'm
programs.
talking about in our district.
Emmett County
what are the-
has a harm reduction program. We do not run it.
Oh, okay, so they have a separate program similar to this that the health department does not run. Okay.
Yes.
Who runs it?
Is it Harm Reduction Services?
Yeah.
Harm Reduction Services of Northern Michigan.
So Antrim County's lucky that you're doing something for them.
Well, we were talking about, all the sharps and stuff that come back. I've probably seen millions of syringes and sharp containers because we offer a drop-off station at our facility. But what could the health department do to help something like that get developed in our four county region? Because I'm kind of amazed that other counties haven't picked up on that, to keep those syringes out of the parks and off the streets. If there's no place to put them, it's like people you provide, but whether people use them or not is not the point, because there's cigarette disposal places all over around every city that I've ever been in, and they still flip them on the sidewalk. But I'm surprised that that none of the other counties mentioned in our district are doing anything about it or providing that service. Antrim being the only one funded for $70,000, for the amount of supplies and materials, the syringes and stuff, seems like an awful lot of money to me.
A lot of that covers staff time.
Well, I know, yeah.
Working with people. and
Yeah,
whatnot, so.
but for what, 64 people?
45,
45.
according to this stuff.
That we know of.
That
That's
we-
just people
that we
we're
know,
dealing
sure.
with, but they're probably sharing. I guess the question is, if you're a druggie and you don't have any money and nobody's providing you with syringes, are you gonna share with your friend? Probably. Or they're gonna steal from you, so now your crime rate's gonna go higher and you'll be busy working. Cause you don't need it, Scott. You don't need that. I'll steal your car. You don't need it. You have more money than I do. I'll just take your car. That's
Drugs-
how the thinking is.
I know how the thinking is done. Drugs drive 90% of the people who are currently in any jail.
Right?
Drugs and alcohol drive 90% of the people who are in every jail
Exactly.
in this country.
Exactly.
Okay, I get that. Is it the place of government to enable that to be a continual situation? I don't think it is.
Yes, your supply and demand, kind of like what you're talking about.
We are not, listen, we are not going to fix the drug and alcohol problem in this country.
We might be able to
Period.
help some people, but not
Well,
everybody.
Okay. Reasonable people can disagree. Do we have any further discussion on the motion to remove the $70,000 from harm reduction services?
Mm.
Can we have a roll call, please, Mel? Hold on. Let me clarify. A yes vote would be to support that motion to remove the $70,000 from harm reduction services in the budget. A no vote would be to allow it to remain. Now can we have a roll call, please?
Commissioner Levanway,
No.
Commissioner Aaron's,
No.
Commissioner Chamberlain,
No.
Commissioner Mapes,
No.
Commissioner Hankins,
Yes.
Commissioner Mason,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Rubing.
Yes.
Tied, motion failed.
Okay. Any further discussion on the fiscal year 2024 budget?
Page. Empty that. Page 15 of 16. Dental Clinics North, Dental Division. You knew this was coming, Scott.
Well, when these were first presented to us, I said to Shannon, I see the irony in dental division being under gray because it is a very gray area.
Well, ever since I've been on this board, I have had comments about why are we supplying dental services to West Branch, Traverse City, Alpena, and the Traverse City one. My page numbers. Alpena is on the backside. It's on page 16. That's the first one on the backside. One, Alpena is 745,000. West Branch is 2 million. Sheboygan, that isn't in our district. That's $1 million. Traverse City, 2.9 million. Mr. Chairman, I would like to strike the dental clinics that are not in our region. We have 4 counties in this region. We do not need to supply dental services to every kid in northern Michigan. Grand Traverse County has a huge budget for their health department. If their kids need dental service, they can get them dental service.
Okay, so I'll do a terrible job in paraphrasing this, but Dental Clinics North is kind of a standalone entity. And the facts and figures you were talking about there total up to $14 million. That's fees and collections. But Dan, help me, because I have a difficult time explaining Dental Clinics North. So go ahead.
Right. Right. So, and she'll correct me if I say something wrong, but.
And quite often Dental Clinics North is the positive financial side of this health department. I know, hold on, let Dan do a better job explaining than I did.
Yeah, so I mean, to understand why we are outside of our jurisdiction, you kind of have to back up and look at the history of how Dental Clinics North started. Early on in the 90s, it was identified of the need for dental services, specifically in children, that public health nurses were seeing. And there was a group of dentists and public health professionals that got together and basically started the first dental clinic in East Jordan. And then it more or less became a partnership with other health departments and identifying needs in those areas. And it spread from there because there is a huge need. Okay.
Hold that thought, Dan.
Yeah.
Jairus, did you make a motion?
No, I did not.
Okay, thank you. Go ahead, Dan.
Yeah, so it was in response to a need, and also it was found that, with the few, starting with East Jordan, the few dental clinics that we had in our jurisdiction, if there were staffing issues, somebody left, or one of the clinics had a higher need than another, the model did not support keeping those appointments going. And then if you can imagine, if you had to cancel a bunch of appointments, it's very difficult once you get out of that cycle. But the staffing model, having multiple clinics throughout the region, lends itself to being more efficient with staffing, because you can plug holes with staff from other clinics if needed. But regardless of that, I mean, it's just more essentially is there to fill a need in Northern Michigan. And people don't necessarily, even though we had dental clinics in our jurisdiction, we saw people coming from outside of our jurisdiction to those dental clinics and filling those appointments. So that is more or less why that has been expanded into the other areas of the region. Am I missing anything, Linda?
Well, and dental, I saw you, Linda. Dental Clinics North is not, we provide
the buildings. Yeah.
the
So we own the buildings.
and the administrative, like payroll, things like that. But they reimburse us then for those services. Is that correct?
Correct. There's a contract between Dental Clinics North, the nonprofit, and the Health Department of Northwest Michigan. Dental Clinics North, the nonprofit, provides the staff, the dentists, the hygienists, the professional staff that are doing the work. And that is a contractual agreement. More or less, they're like a staffing agency for those dental professional services. We have the equipment, we have the offices, the dental clinics themselves. And we provide, we take care of the facilities management. We have a management fee because we take care of all the billing for those dental clinics. And they are just simply providing the professional services to do the work.
Okay. Now, this is a unique opportunity for us because we have Linda Yarrow, who is a former health officer, who was probably instrumental in this time period when Dental Clinics North became part of our organization. So Linda, I'm going to ask is there anything that Dan left out?
You probably have to turn on your mic, Linda.
Basically, Dental Clinics North was formed, as Dan mentioned, as a result of really trying to address the oral health needs of children and adults throughout not our 4 counties, but as a region with our other local health departments partners. So Dental Clinics North is a partnership of local health departments, including those that we serve, District 4, District 2, Grand Traverse, and ourselves. And the reason that is because it's more efficient and effective to be able to do a large number of clinics rather than 3, for the same reasons that Dan just said. About a year ago, I think it was, Scott, maybe it was about a year ago or so, I sat down with Jairus, you, and Mr. Mason. And we began an orientation around Dental Clinics North. And what I would suggest before you just think about making any changes in the dental structure is that we continue that discussion and education, because it's really not tremendously complicated, but for some reason it ends up in the complicated box. And so I really think we have to have time to do that. It's not that this health department the Health Department of Northwest Michigan owns the dental program. Dental Clinics North is what it's called. We own all of the supplies and the materials, the buildings, the equipment. We own everything through the health department. The staff that does the intake, the staff that does the billing, the staff that receives the money. There is one contract line in that big budget that goes out to Dental Clinics North nonprofit, and that's to hire the staff. They are a staffing agency only. So you start breaking that down, it destroys the system. The system right now of Dental Clinics North serves over 30,000 people a year in over 60,000 visits. So any decision you make is going to impact not only our 4 counties, but the northern region. And you may not find yourself being responsible for that, but you benefit from that. We, as a health department here, benefit from that, and you're going to be benefiting even more so. Because with the reimbursement changes in Medicaid, with the restructuring of that dental benefit to be a better dental benefit, this health department is going to benefit financially. And as Dan mentioned, would be able to now serve through the Northern Dental Plan, which is a low-income uninsured plan, and be able to offset some of those costs. When you're seniors, you lose your dental benefits. When you're, different times in life, those dental benefits are hard to get. So it is complicated to some extent, but really it can be simplified. But we have to have the time to do that. So I would request that you don't make any changes in the dental structure today.
Thank you, Ms. Yarrow. Mr. Mason. Oh, Linda, actually,
Yes.
maybe.
Questions. Have you borrowed money through the dental clinics to fund the operation of the clinics? Have you got money on loan from the board, from the health department?
I serve currently as the chairperson of Dental Clinics North nonprofit organization, the staffing organization. The health department, this health department, when it formed Dental Clinics North nonprofit, it had moved that staffing entity from Michigan Community Dental Clinics. That contract was with MCDC, who this health department also formed at that time. Discontinued that contract about 4 years ago or so and formed DCN nonprofit. Okay. At that time, this health department loaned DCN nonprofit $350,000. So that sits there as a dollar amount due back to this health department from DCN nonprofit, which this next year they intend to be able to pay back through a mechanism that they're going to get additional funds in for their staffing, and they'll be able to pay that back.
In this 4 years, how much of that has been paid back?
In this 4 years, in this past 4 years, I'm probably not the best person to speak to that right now, but that still sits on the books to be paid back to this health department from DCN nonprofit.
Thank you.
I just add to that a little bit. I think that primarily, that was not the intention. It's just, when COVID happened, dental clinic services went way down, the funds were not there. And there was, now that people are starting to come back, so that we had this basically 2 or 3 year period that it wasn't possible to pay that back because of the services weren't being done. Now that, is rebounding, and that's, as Linda mentioned, now, they're going to be in a position to be able to.
This is all part of the explanation that we need to go through a little bit more in depth. DCN nonprofit is not an income generating entity. So it serves a purpose for this health department. It gets reimbursed for that purpose, period. And which is the staffing of those clinics. So it doesn't make money. So in the very beginning, it had to provide them with their first allocation of being able to reimburse their staff for their services for payroll, essentially. And so in the end, they will pay that back to the health department, but that requires a revenue stream for that to happen.
If I can add to that, Linda touched on the MCDC relationship prior to DCN. We did the same loan with MCDC, and that sat unpaid for 10 plus years. So we are already way ahead of the game.
Well, and also this past few years through, this will become probably the first year that, in the past, Dental Clinics North and the general operations of the health department have maintained their fund balances separately. And so over time, over the course of time, the dental clinics project has been cash positive and and puts money into their fund balance. The last few years have been tough because of the COVID and whatnot. So they didn't make money in the last few years. This health department's fund balance did not support them, but their fund balance did. And this year will be probably the first year that now money will go back into that. So it will be a mechanism to try to secure the funds to be able to negate that $350,000 loan. And we're working on that at this time.
All right, thank you,
Mr.
Linda.
Chair.
Mr. Turnbull.
So what it sounds like is they're reimbursing what they're borrowing, what they're using. So it doesn't seem too far-fetched or too unreasonable if we were to transition it to West Branch to Traverse City and tell them to take it. They're not going to be taking over any debt or anything. Like, actually sounds really positive. Well, it's just a transition, a handshake, and I know it's more than that, but what does HDNW benefit by maintaining control of these dental clinics that are outside of our jurisdiction?
Well, for one thing, this year they're going to be income producing, and so you benefit there. And the organizationally, again, it is very difficult to run 2, 3, or even 4 dental clinics. It requires an expert, a certain staff, obviously dental. Not anybody else in the health department has those credentials. And that in itself, for the flexibility of being able to maintain the services in all of our sites at all times, there's always ups and downs. A dentist leaves here, a dentist comes there. We always have management of staffing and delivery of services that can be spread out across that benefit and risk can be spread out across our 8 clinics. Those other clinics that you're talking about are very successful, especially Traverse City. And to eliminate them would be actually to eliminate your revenue stream. So this is part of the complexity that you really have to understand better and why we do what we do, and that you can't just break those down nor hand them off. There's nobody to hand off to, number one. They're not going to do 1 or 2 clinics. That doesn't work. That's how we started this. Their clinics, they did have, the Traverse City Clinic was a clinic by itself. Sheboygan was a clinic by itself. When we formed Dental Clinics North, those were the 2 first clinics into the system because they'd lost their dentists and had to close their doors. So there sat a fully equipped dental clinic without staff. So we were able to regroup, resupply, re-up, and have the clinics fully functional again. They couldn't do that by themselves. So that's kind of some of the histories too.
Can I add to that, Linda? This is
Mhm.
Shannon. Sorry. Last year, you have to remember, we closed HDNW in a negative status. And it was Dental Clinics North that allowed us to close the books and break even, basically. If you get rid of half of the clinics, let's just say half, the ones that are not in our jurisdiction, it puts us in a really interesting place because a lot of those clinics that are in our jurisdiction are not the big money makers. Beaver Island, we lose money on that left and right, but we are able to provide a service to the children on Beaver Island and elderly on Beaver Island because those costs can be absorbed by the more profitable clinics that we have across the state. And I think that's what Linda's getting to when she says, if you close 1 or half of them, then it puts us in a tricky spot. But yes, your question, Commissioner Turnbull, was how do we profit from this? Last year, we closed our books. If we can't close our books, it's going to put us in a really difficult spot. And I don't think you want me coming back and asking for additional funding the next year if I don't have to.
As the equipment ages, and it's now a few years into use, longer than 4 years, there's going to be a cost at replacement. What is that? What do you got for estimated costs, perhaps within 5 years, for maintenance of dental equipment?
So
It would be a huge cost.
if you look on our budget that we have for dental, there's an equipment line item, and I'm just going to give you the in total. The last page, 16 of 16. There's an equipment line item about 3 up from the bottom. So the total for Dental Clinics North is $143,000.
That's presently,
for fiscal year 24. Yes.
that's the equipment cost for the, replacement parts, whatever it costs, what is.
At this point, it's all mostly replacement. If we're purchasing new, it's very, very little.
But things wear out. We're seeing a
Yeah,
lot of
that's
patients.
part of
and
it.
So chairs wear out, hand pieces wear out, equipment wears out. You know, there's always a replacement need in a dental clinic.
So with that, does that allow you to move forward, saying that you're gonna be able to pay off next year? You know, if you've had, where were we?
143,000 this year.
Yeah, is that roughly your cost for next year in replacements, or will your costs be greater?
We have a plan, so like a 5 to 10 year plan with the dental clinics of replacing things as they come. So like, for example, an easy example would be computers or laptops, IT equipment. We don't want to have to replace it all at once. So every year we factor in and budget in X amount to start replacing some of those on a long-term plan. So I would say, you know, that it will continue to be that unless there is something extraordinary that were to go out or need to be replaced.
Some of that equipment could be $70,000-$80,000 for a single piece. If something like that went
That's
out,
pretty.
That seems high.
pay off that.
Usually they're in the $10,000 to $15,000 range.
I know some equipment that they use for molding, caps and so on are up in the $70,000-$80,000.
We don't have any of that
We don't,
particular
yeah.
equipment on site.
I mean, the cost for replacing equipment it's just part of doing business, right? So it's accounted for in the budget regularly. It's nothing that we're expecting to be a surprise of, and we're certainly not going to do it all in one year. So
Ms. Levan.
I have some questions. Okay, so looking at the chart on page 15, it shows, well, first question, why do you break it out? Why are you breaking it out? Just to make it easier to understand who's making money and who's not?
this is how we account for it. We want to be able to track each dental facility. So if we see that there's, a dip in one month, we look at this monthly. It's not like we just wait till the end of the year. So every month we're watching, have we seen a decrease this month? Will it increase next year? What did it look like last year? So that's why we're breaking it out. We could roll it all up into one, but this is how
Then
we
you went,
track
no.
it.
Okay, that makes sense. So this is more like a regional dental clinic. It's not just the health departments. The health department is just the person claiming the region. Is that correct? It's got to go through some, right, but it's got to go through somebody. It's got to go through a health department somewhere. And it obviously years ago, they decided to go through this health department to create this. Correct?
Because we had the most experience.
Right. Okay. So that makes
there was
sense.
such
So
a
it's like regional,
Mhm.
regional schools, ISDs. It's what it sounds like to me. Does that make sense?
Yes.
Okay.
Yes.
So here's my question. My question is, we now broke it out. We broke it out by salaries and wages. The first column is, I don't understand that. The first column that says dental clinics north and it has revenues and expenditures.
I'm going to let Andrea explain it because she's the expert.
Okay.
As part of the, is that on? As part of the contract that we have with DCN, the nonprofit, the health department contracts to them some services. So some of our IT personnel that work for the health department are contracted to the nonprofit. We have some administrative function, billers, different.
So that's
costs.
us. The first column is us.
That's correct. The first
Okay.
column is us, but the revenue, if you see the revenue that covers the entire cost is what is then
Everybody.
paid back to us by Dental Clinics North, the nonprofit. Then in your next column, you have 611, the dental regional coordination. That's the actual expenses of the health department staff that are attributed to the operations of the clinics from the health department side. The billing,
Ed, Shannon, myself, different pieces. And so those are then spread in the bottom line that, third line up from the bottom that says program supervision. Those costs are then spread to each one of the clinics.
Okay, so it's not necessarily we're paying for it all. No, because it's a region.
Yes.
And it's very interesting. If you look on here, Mansalona and Gaylord and West Branch are the positives and all the rest are negatives. So you're right. There's no way this health department could even, it'd probably break even if you're lucky. If we kept it just our region. If we're lucky.
If we're lucky.
Well, and if we were to subtract, and I get it, Jairus, I've tried to wrap my brain around this thing a lot of times too, looking at our 4 counties. Why are we in West Branch? I get that. I understand the explanation. And if we were to only have our 4 clinics, Dental Clinics North may not include us at all, and we'd have to start from ground zero.
If I could
Is
just,
that accurate? Yeah, that's why it's in gray, Linda. That's why it's in gray. But if we were to say, okay, so the example I'm giving is if we were to say, okay, we're done with Dental Clinics North today. We'll let the attorneys work out all the paperwork, but we're done today. We're only going to have dental clinics in our 4 counties. Dental Clinics North may say, okay, you do what you got to do, but you're not doing it with us. We're going to go stand alone and be our own entity entirely. And you guys have to come up with all of the dental staff to maintain your 4 offices. That's a very basic
And you said it,
explanation, but
you said it's nonprofit, right? It's a nonprofit. So is your fund balance in here in our, does your fund balance come into our audits too or no? No,
It's not on this document that you see today.
no. So
Yeah, there's a fund balance. I just didn't put it in the document that's in front of them.
The dental clinic is the health department program. It has fund balance. I'm your fund balance.
Right.
You are due diligence for fund balance. Not the nonprofit. We don't have a fund balance. We're in and out the other organization for you.
So it always comes to us.
Correct.
Right.
okay.
if I could also, I'm sorry, Scott, could I just?
Well, no, hold on, Andrea. Dan had his hand up first, I think.
Yeah, I was just gonna point out too that, I mean, to undo, we own all these, we either own or rent all these offices. So I mean, there would be a huge cost to not do this anymore, because we have all this space to unravel that and the legal costs and, what do we
Loss.
do? What do we do with this?
It'd
with
be a
the
loss.
space? It would be a huge cost to the health department, which I don't think we could, I would say well over $1 million, maybe even 2. So that would be very costly to without going into, it's complicated, like Linda said, but that would be my fear on that end too, is that it's not only detrimental to the services, but there would be a cost to doing that.
Andrea, briefly, please.
Sure. I just wanted to add that, we budget very, very conservatively. If you look at, we try to come to pretty much a break even, a balanced budget. However, quite often that's not the circumstances with the dental clinics. They do tend, probably more years than not, to have a positive. And especially now that the reimbursement rates have changed, we anticipate much more surplus than you are seeing in the budget itself. I just ran a quick number, and of the 4 clinics that are not in our region, through July 31st, they are at a surplus of $250,000 that will go directly into this health department's funds.
Okay, thank you. Is there any further discussion there was not a motion, so is there any further discussion on the fiscal year 2024 budget? Hearing none, would anyone like to make a motion for approval of the proposed fiscal year 2024 budget?
I will make that motion because I'm the chair of the finance committee.
Second.
Second.
It's been moved by Ms. Levanway, seconded by Mr. Chamberlain. Almost didn't think of your name for a minute. Any further discussion? Hearing none, can we have a roll call, please?
Commissioner Chamberlain,
Yes.
Commissioner Hankins,
Yes.
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Mason,
No.
Commissioner Rubing,
No.
Commissioner Turnbull.
No.
Motion passed.
All right. Ladies and gentlemen, that moves us back to public comment. I did have a request from Mr. Mason for some time of commissioner comment. Do you want to wait until after public comment,
We
Henry?
can do that.
Okay. So public comment again, ladies and gentlemen. Again, if you would please step to the podium, state your name and which county you reside in. You'll have 3 minutes to address the board.
Good afternoon. My name is Linda Travis. I'm a resident of Antrim in Elk Rapids. As a citizen, I have a concern after listening to these discussions. The question I have and concern is of which and what citizens we protect from illness, lack of funds, and personal responsibility. Is it children? Seniors? Drug addicts? What are we doing? Picking and choosing? And then if you throw in politics, which is thrown in, and religion, which is thrown in, and sins, which is thrown in, and a lack of specific data. For example, a guy from California said the problem's worse out there. Well, that's data. That's not data. That's anecdotal. Who is worthwhile for any health care, mental, physical, addictive? What do we do? Pick and choose? So the solution is what? That's what you people are sitting here for. And I think your discussions are appropriate, but sometimes we get down into personal feelings, religions, politics, and that we don't look at the entire population, which is what your mission says. We look anecdotally. Someone complains about 3 times Narcan had to be used to revive one person. So what's EMS supposed to do? Walk the same way and say, well, he wanted to die because he had no personal responsibility. Just let him die. What is the solution? Come on, folks. We're trying to nitpick a good board of health to pieces. Let's step up and keep with a good board of health. As a citizen, I thank you for your service, but I want you to open your minds and hearts to more beyond your personal thoughts. Thank you.
Greg Hickey from Edmond County. I'm really disappointed. You had the opportunity to show some fiscal responsibility to help start to shrink government. You did the complete opposite. You helped grow government, you kept it in our pocket. Just made things worse. Oftentimes, you say, who are you helping? Well, I don't know. Then you ask the other question about funding. You have all this stuff about funding. Oh, we're gonna get this funding. We're gonna get all this funding. Where's it coming from? It's coming from all these funding sources that ultimately come from your back pocket. So when I hear all this stuff, well, Medicaid's gonna fund this and Medicaid's gonna fund that. You know, I'm sorry, but that's coming out of my back pocket. That's my tax dollars. That's one thing I would like to have people actually take some personal responsibility for, is their health. Why do I have to use my tax dollars to pay for somebody else's health who don't or won't take responsibility for their own health? It just bothers me that I have to pay for somebody else's kid when they probably shouldn't have a kid. Why do they have that kid in the first place? I mean, just so that I can take care of that kid? No. You know, I'm sorry. I have a heart and I feel sorry for these people, but I did put them into these situations. They often put themselves into this. As a former law enforcement officer, I can tell you that needles were a horrible, horrible problem, especially when you were trying to pat somebody down. And when you were patting them down, we ended up having to buy thick gloves because these needles were such a problem. And you know what? With these programs that we're saying, bring us your dirty needles so we can support your habit and give more. I just can't buy that. I'm sorry, but my empathy only goes so far. And I think we're wasting a huge amount of money and we're doing it. Some people would say scripturally to take care of your neighbor, but you know, there's a point where you have to say enough is enough. And I think we've reached that point. We've gone past that point. And shame on you that voted all for this stuff, because you're helping to fund government even more, helping it to grow even more, and even more getting it out of control. Thank you.
Would anyone else like to address the Board of Health?
Mary Lieberman, Emmett County. First and foremost, I just want to compliment both Shannon and Andrea on their presentation of the budget today. They made it done in a way that was clear and concise. And for those of us
Ma'am,
in the audience.
Ma'am, we do have rules for public comment, and one of the rules specifically states that you are not allowed to address anyone who is employed by the health department. Good, bad, or indifferent.
I'd request that my 3 minutes start over, please.
They can address commissioners and they can address the chairman, but they are not to address health department employees. We've been down this road before, Mr. Chairman.
My question is to the chair who's organizing or running this portion of the
Yes.
meeting. May I start over, please?
Go ahead.
Again, I would like to compliment the people from the health department who did their presentation of the budget today. They did it in a clear and concise way that should have been understandable to everyone on the board, but it also was appreciated by those of us in the audience. It helped us to have greater understanding. I'd also like to compliment the board for their questions, though it might have taken a while. I appreciated them because it also helped clarify. I'd like to also extend appreciation to the health department staff for their perseverance, their professionalism, and their concise way that they responded to every question that was thrown their way. Again, in a way that was understandable to all of those who were active listeners. One observation I did have is I can't say that all of the board members were active listeners. They were good at asking questions, but when the answers were being provided, they were busy writing, doing other things, and absolutely not giving the person the respect of listening to their response. I hope that doesn't continue in the future. Thank you for your service. Thank you for passing the budget, and I hope we can move forward in a positive manner that's beneficial for all the constituents of all 4 counties. Thank you.
Rule number 6 states public comment shall be addressed to the chairperson, not the health department staff or individual Board of Health members. Just a reminder for everyone. Would anyone else like to address the Board of Health? Hearing none, I'll take a motion to adjourn.
Mr. Chairman.
Oh, Mr. Mason did want to have opportunity for commissioner comment. Go ahead.
Okay. I have a point to make by this. little over a week ago, a meeting was held and someone's feet were put to the fire pretty seriously. And a couple of examples from the Bible. Pontius Pilate was asked to stand in judgment of an innocent man, God the Son, Jesus. And when the pressure was placed on him by the crowd, he relented and allowed our Lord to be handed over to the crowd. Of course, he knew, even though he washed his hands, he wished to remain neutral. He was not innocent, knowing the result to be had. We go further, and Jesus comes across a woman ready to be stoned by several men in their anger because she was unfaithful. And perhaps the question to be asked, how many of them might have known this woman as more than just a passerby? He knelt, and then he started writing their names in the sand, and he asked, whoever was without sin should cast the first stone. And then shortly, these men dropped their stones and left her. He reminded her to go and sin no more. The Bible doesn't tell us, but this woman was pardoned by Jesus present in physical sense, and perhaps became a saint that day. But those who decided to cast stones a little more than a week ago did so, in my opinion, the very honest man who was guilty of what? How many of us on this board, other than those members that were present that day, would perhaps have joined in casting stone, or the one vote defending this man? Could I have defended him? I would hope so. I don't remove myself. I'm a sinner as anyone else. But we have to have strength to stand up and represent honesty and truth. And it's going to be hard, I think, for many to really understand what happened that day to a man that we talk about compassion. I wonder how many sleepless nights this man had for being accused of something he never did. That's all, Mr. Chairman.
Thank you, sir. Mr. Turnbull, do you have any comment?
It's just to add that, I mean, there are some things, there are things that gnaw on a man worse than anything else, follow somebody through their entire lives, and that's the decisions that we make to support a friend or not. I mean, everybody has their own choice, and we have freedom of choice. I mean, also you have that in our Constitution, we have the freedom of speech, different freedoms and different rights, but yeah, I do not pity anybody that cast those stones, because that's, I mean, treachery, deceit, things like that, and non-person their entire lives, and for what? I mean, politics, I guess. That's all I have to say. And I do wish that we would hope that we can continue with the vocation, because that really helps center myself, and gives everybody clear heads and calm hearts, and makes things run well. So I hope people can continue with the vocation.
Thank you, sir. Mr. Chamberlain.
I'd like to share that. This morning started off with us meeting with our nurse from the health department. My daughter was attacked by a dog on Saturday, and we had to sit down and actually meet with the nurse, and it was nice having one that understands how to treat the wounds, because it does have to be cleaned twice a day. And it was kind of nice being able to see how that program actually does help besides just COVID. That's about it.
Thank you, Mr. Aaron's.
Good afternoon. I'm new here, but I was looking down here at the name tag here. On the back of it, I appreciate this right here. I know you guys can't see this, but it's the mission of the health department. Okay. First 5 words seem very appropriate to some of the discussion that happened here today about separating certain classes of people or their problems from others in our treating them and helping them. It says to serve our entire community. Those are the first 5 words of the mission. Entire means all. not just the people you feel deserving or they've made better choices in life and things like that. That doesn't apply. The first 5 words are to serve the entire community. And indeed, as commissioners that sit on this board, we are to serve our entire community in our respective counties. That's what we're elected to do. That's one of our charges. We represent our districts, and we have to represent the entire county in our thoughts and our actions and our voting. You know, that's what we do. We should do. We don't just only serve the people that like us. We serve everyone. Otherwise, why are you sitting here? That's what I would say. Why are you sitting up here at these desks? If you don't do that, it always, well, for 7 years, it's always been perplexing to me when people want to separate out people. And as far as invocation, I think those are great in church, but not in public meetings personally, since we're talking about our personal wishes about that. Moment of silence, I think, is entirely appropriate. When I came to this meeting, the last meeting here, sat in the audience, didn't have any public comment or anything. I just wanted to see how this went. I was surprised that, I mean, so many comments, it felt like it was a church revival in here. It didn't seem like a meeting, a business meeting meant to deal with the people's business. I mean, we've got plenty of places of faith around here, and not everybody is of the Christian persuasion. I think, you know, the moment of silence is a good solution to that. So, that's what I have to say.
Mr. Mapes.
I'd like to thank Shannon for the work that she did on the budget. It was very easy to understand for a newbie, even though I spent hours yesterday, but the more I looked at it, the more questions I had. And thank you for answering those questions today. I would like to support the idea of invocation. I agree that the fact that this is a centering point for any committee. That's it.
I have no comment.
Mr. Rubin.
I guess I would just point out, I guess it's pretty obvious that this health department, we just passed the biggest budget that has ever been passed. And the growth of government continues marching down the path. If it's similar to last year, we'll have another budget amendment where we'll add another $2 million to a $34 million budget. So we'll have $36 million budget for the health department for the coming year. Thank you.
Okay. Now I'll entertain a motion to adjourn.
I make a motion.
Moved by Ms. Levanway. Is there a second?
Second.
Seconded by Mr. Aaron's. All in favor, say aye.
Aye.
Aye. Thank you, ladies and gentlemen. We're adjourned.